Hello and welcome, Maryville community and faculty. My name is Brittany Adams. I'm a Doctor of Nursing Practice student here at Maryville University. Today I am presenting my DNP Scholarly Project. This is a quality improvement project titled Screening for Substance Use in the Adolescent Population, Efficacy of the CRAFT Screening Tool. I would like to introduce and give thanks to my committee members, my DNP faculty chair, Dr. Michael Graham, and community member Dr. Samuel Fodari for their invaluable assistance throughout the duration of this project and continued encouragement. Screening for substance use in adolescents is essential to identify risk and to initiate early evidence-based treatment interventions. Substance use is a growing epidemic in our nation and is often established during adolescence. Smoking, drinking, and illicit substance use are leading causes of morbidity and mortality during adolescence as well as later in life. Implementing early treatment interventions and education can help reduce adverse healthcare outcomes later on to include the potential for addiction and substance-related morbidity. Without adequate, routine, evidence-based substance use screening in adolescents, substance use can go undetected and persist throughout adulthood, often leading to addiction and substance use disorders. Within the community-based behavioral health care clinic I work, the screening process for substance use is currently a non-standardized, single yes-no question initiated during the intake process. After patients complete the intake process, they are referred to physician services for medication management and treatment. Physician services is the term used at the behavioral health clinic that includes a team of psychiatrists and psychiatric mental health nurse practitioners. Like the initial intake process, the psychiatric providers do not currently use a validated screening tool to identify substance use during patient visits. The CRAFT screening tool is a recommended evidence-based substance use screening tool used for the adolescent population. The aim of this quality improvement project is to determine if implementation of the CRAFT screening tool can assist in identifying problematic substance use in adolescents between the ages of 12 and 18 within a community-based behavioral health care clinic. The hope is that by implementing the CRAFT screening tool, the psychiatric providers can early identify problematic substance use and guide the provider's patient assessment, counseling, and referral for treatment. The Centers for Disease Control and Prevention reported between 1999 and 2016 drug overdoses resulted in over 632,000 deaths in the United States, and unfortunately, this epidemic has continued to worsen across all drug categories. The National Survey on Drug Use and Health reported that between 1975 and 2018, alcohol was the most commonly used substance among adolescents, followed by marijuana and smoking cigarettes. The Substance Abuse and Mental Health Services Administration, better known as SAMHSA, reported that nearly 1 million adolescents between the ages of 12 to 17 had a substance use disorder as of the year 2017. This data represented 4% of the adolescent population in the United States for that year. Additionally, the American Academy of Pediatrics described the impact of adolescent substance use to include the overall impairment of growth and development in association with risky behaviors such as unprotected sex and dangerous driving, and substance use contributing to the development of many other health problems, both physical and psychological. Now that I've described some of the background on adolescent substance use, let's discuss the significance of this problem. Research data has shown substance use in adolescents as a significant healthcare disparity that is not often identified and can result in many adverse outcomes. Substance use and substance use disorders significantly affect the overall public health burden in the United States. Data from the National Survey on Drug Use and Health survey results in 2018 reported that over 164 million individuals ages 12 and older used a substance within the past year. Of these, over 20 million were diagnosed with a substance use disorder. The National Survey on Drug Use and Health continued to describe that as of the year 2018, over 18 million people ages 12 and older needed substance use treatment but did not receive services. Of these 18 million plus individuals, approximately 964,000 adolescents between the ages of 12 to 17 perceived the need for substance use treatment but did not receive these services. Data from the 2009 expenditures report showed that the United States spent approximately $172 billion on mental health and substance abuse treatment. The expenditures report from 2014 reported that mental health and substance use disorder treatment spending from all sources is expected to total over $280 billion by the year 2020. A study by Coons and Associates identified low rates of healthcare providers performing routine screening of adolescents to identify potential substance use. A significant concern with adolescent substance use is the lack of healthcare providers' routine use of evidence-based substance use screening tools. It is imperative that healthcare providers and organizations adopt policies and procedures to include routine substance use screening in the adolescent population. After conducting a review of current literature, the outcomes associated with the CRAFT screening tool have been organized into 4 themes. The first theme, evidence-based guidelines for substance use screening, describe the recommended screening processes, models, and tools. The Screening, Brief Intervention, and Referral to Treatment, better known as SBIRT model, is a widely accepted and recommended method to identify individuals at risk for substance use, increase awareness of substance use, and provide education and refer those at risk for specialized substance use treatment, according to several organizations and agencies, including the American Academy of Pediatrics, American Society of Addiction Medicine, Centers for Medicare and Medicaid Services, National Institute on Alcohol Abuse and Alcoholism, and the Substance Abuse and Mental Health Services Administration. The CRAFT screening tool is a recommended evidence-based substance use screening tool that is recommended under the SBIRT model for use in the adolescent population. Among the studies reviewed, several found that healthcare providers trained on SBIRT and utilization of evidence-based substance use screening tools, such as the CRAFT, had overall improvements of SBIRT knowledge, self-efficacy, and utilization of substance use screening in practice. Research also supports that the lack of implementing evidence-based substance use screening processes and use of recommended screening tools could result in a lack of detection of substance use and problematic behaviors related to substance use. The second theme, problematic substance use and behaviors, showed that the CRAFT is a screening tool used to help identify problematic substance use and substance use risky behaviors among adolescents. The vast majority of literature reviewed from the studies indicated that the CRAFT screening tool yielded significant results for identifying high-risk problematic behaviors or substance use dependence, as well as support to be a valid and reliable instrument in identifying problematic substance use among adolescents. One study by McCabe and Associates identified an association between a positive score on CRAFT and increased odds of obtaining and using opioids, while 2 of the studies found a correlation between positive CRAFT scores and criminal behaviors to include how the substances were obtained. The theme of barriers for screening yielded many results with healthcare professionals responding. A common finding among several of the studies reviewed showed low rates of healthcare providers screening for adolescent substance use using either a validated or an unvalidated substance use screening tool. 2 studies identified main reasons for providers' lack of routine substance use screening. In these studies, the majority of healthcare providers reported they wanted increased reimbursement rates to perform such routine screening, the need of dedicated trained staff and technology to perform the screenings, conflicting beliefs on whose role it is to perform the standardized screening, and concerns for time constraints. Finally, the theme substance use tool yielded many results related to the use, validity, and outcomes of CRAFT. The CRAFT screening tool has been widely validated and used in outpatient healthcare settings and was specifically designed for adolescents, being the most thoroughly studied substance use screening tool for this specific population, according to Dalla and Associates. Ostarelli and Associates found a positive correlation with elevated CRAFT scores and a diagnosis of substance use disorders, biological test of recent substance use, self-reported history of trauma, and history of previous suicide attempts. The majority of the studies reviewed found the CRAFT screening tool to yield high sensitivity, concurrent validity, brief and easy to administer, and adequate psychometric properties. Several of the studies reviewed compared the efficacy of multiple substance use screening tools, and CRAFT was deemed valid and reliable. The conceptual framework used for this scholarly project is Kurt Lewin's classic theory of change. Change is a key component of nursing, healthcare, and leadership within an organization. Lewin's theory proposes 3 major phases of change process. The first phase of change is described as unfreezing. The phase of unfreezing involves increasing the driving forces of change while decreasing the restraining forces. Driving forces include moving towards goals, while restraining forces oppose the driving forces and can act as an obstacle for change. Phase 2 of Lewin's theory of change is moving or changing. Lewin described this phase as the time where the benefits of a proposed change are further identified and a time where brainstorming, training, and disseminating a plan for change takes place in an active form. This phase requires clear communication, encouragement, and support among the group and organization to achieve the desired change. The final phase of Lewin's theory of change is refreezing. Lewin described the refreezing phase as a time where the implemented change is now viewed as the new norm or new level within the organization's atmosphere. During the refreezing phase, it is important to find a way to incorporate the change within the organization to create a new norm and sustain this change. Methods and design. A quantitative exploratory design through a retrospective chart review was utilized for this project. Participants were not engaged, and no identifying patient information was extracted from the electronic medical records, better known as EMRs. The data for this project was extracted from EMRs of patients enrolled in services at a behavioral health clinic in the Midwest. Patients' EMRs included were all individuals between the ages of 12 to 18 seen at the behavioral health clinic. EMRs from the behavioral health clinic were utilized for data collection, and this included a review of 308 EMRs. This researcher recorded the minimum necessary data to accomplish the goals for the project on a data collection sheet. Data collection began on June 1st, 2021, and I reviewed 154 EMRs within the pre-QI intervention period of time from February 1st through March 31st, 2021, and 154 EMRs during the post-QI intervention period of time from April 1st, 2021 through May 31st, 2021. The CRAFT screening tool was utilized by the healthcare providers on every patient between the ages of 12 to 18 who are enrolled in services at the behavioral health clinic. The CRAFT screening tool is comprised of 2 parts, Part A and Part B. Part A of the CRAFT screening tool includes 3 questions regarding the number of days in the past 12 months that a person has used alcohol, marijuana, or synthetic marijuana, or anything else used to get high. Part B is comprised of 6 yes or no questions. Question number 1 in Part B is answered by all individuals, and questions 2 through 6 are only answered if the individual answered yes to any of the questions in Part A. A data collection sheet was created by this researcher after extensive literature review was conducted. In this project, each EMR was assigned a number on this data collection sheet. Coding for individual data collected is represented as nominal data in a yes-no format, with 1 equaling yes and 2 equaling no. The statistical programs used for this project included Microsoft Excel and the statistical package for the social sciences, better known as SPSS software. A parametric z-test was used for interpretation of data to compare pre-QI intervention data using a non-standardized yes-no substance use screening question and post-QI intervention data with use of the CRAFT screening tool. Z-tests compare ratios and percentages before and after the intervention. For this project, a z-test was used to determine if there was an improvement in rates of screening, substance use disorder diagnoses, counseling, and referral to treatment pre- versus post-QI interventions. Compared to the non-standardized screening question, the CRAFT screening tool documentation of completion resulted in a p-value of less than 0.05, suggesting an increase in the ratio from non-standardized screening question completion to the CRAFT screening tool completion. The achieved power of the study at 0.6173, which is considered medium in strength. A total of 141 out of 154 EMRs showed documentation of completion of the non-standardized screening question, and 149 out of 154 EMRs showed documentation of completion of the CRAFT screening tool. The z-test for difference of 2 proportions revealed that there was a significant difference between documentation of completion between the non-standardized screening question and the CRAFT screening tool. Compared to the non-standardized screening question, the CRAFT screening tool diagnosis of a substance use disorder resulted in a p-value of less than 0.05, suggesting an increase in the ratio from non-standardized screening question and the CRAFT screening tool. The achieved power of the study is 0.9346, which is considered medium to high in strength. Data gathered from the EMRs indicate that 8 out of 154 individuals were diagnosed with a substance use disorder with use of the non-standardized screening question, compared to 25 out of 154 individuals diagnosed with a substance use disorder with use of the Kraft screening tool. The z-test for the difference of two proportions revealed that there was a significant difference between the diagnosis of a substance use disorder between the non-standardized screening question and the Kraft screening tool. Compared to the non-standardized screening question, the Kraft screening tool provider-reviewed screening results with patient resulted in a p-value of less than 0.0001. There is sufficient information to suggest an increase in the ratio from the non-standardized screening question and the Kraft screening tool. The achieved power of this study was 1, which is considered high in strength. Data gathered from the EMR showed that 0 out of 154 individuals had screening results reviewed with the patient with use of the non-standardized screening question, compared to 148 out of 154 individuals who had screening results reviewed with the patient with use of the Kraft screening tool. The z-test for the difference of two proportions revealed that there was a significant difference between provider reviewing results with the patient between the non-standardized screening question and the Kraft screening tool. Finally, compared to the non-standardized screening question, the Kraft screening tool provider-performed an intervention, such as counseling or referral, resulted in a p-value of less than 0.0001, which is less than the significance of p is less than 0.05. There is sufficient information to suggest an increase in the ratio from non-standardized screening question and the Kraft screening tool. The achieved power of this study was also 1, which is considered high in strength. Data gathered from the EMR showed that only 1 out of 154 individuals the provider performed an intervention with use of the non-standardized screening question, compared to 149 out of 154 individuals the provider performed an intervention, such as counseling or referral, with use of the Kraft screening tool. The z-test for difference of two proportions revealed that there was a significant difference between the provider performing an intervention, such as counseling or referral, between the non-standardized screening question and the Kraft screening tool. There was a statistical significance between pre-QI intervention with use of the non-standardized screening and post-QI intervention with use of the Kraft screening tool across all 4 variables compared. This project successfully established a change with use of the Kraft screening tool versus a non-standardized substance use screening question. The results of this project and 4 variable outcomes measured were able to successfully reject the null hypothesis, and the results are statistically significant. The study met its goal and provided significant evidence that the Kraft screening tool resulted in an increase in provider completion of substance use screening, improved the identification of substance use disorders, review and discussion of screening results with patients, and providers performing substance use interventions such as counseling and referral for treatment. There were several strengths identified after completion of this project. To my surprise, during the pre-QI intervention period and providers' use of only the single non-standardized substance use screening question, 0 providers showed any type of documentation reviewing the results of the substance use screening question with any of the patients. Conversely, post-QI intervention screening results, a total of 148 out of 154 patients had their screening results reviewed with them by the provider after use of the Kraft screening tool. Additional strengths of this project include a larger sample size than what was initially predicted, thus adding to the significance of the results. The study design did include adequate generalizability. Another strength that was unanticipated and unmeasured was the positive feedback received by the providers utilizing the evidence-based Kraft screening tool regarding the ease of use, the small amount of time that it took to complete the screening, and enhanced discussion between the provider and patients regarding substance use and opportunity for additional education. Even though the data collected for this project used appropriate statistical analysis and represented the study's validity, this project did have several limitations. While all providers received an educational presentation and training session with me prior to use of the Kraft screening tool, there were several employees hired after this presentation without my knowledge. Due to the information collected based on data collection plans for this retrospective chart review, I was unable to identify any patients in the organization who might have refused to answer or complete the CRAFT screening tool or the non-standardized substance use screening question. Also, due to the ongoing coronavirus pandemic, providers within the behavioral healthcare clinic may have performed the pre-QI or post-QI screenings by means of telephone or telehealth visits. There is no way to determine which method the provider used, as the data collection would not represent this. This scholarly project aimed to improve the identification, assessment, and counseling or referrals for the adolescent population by utilizing an evidence-based substance use screening tool, CRAFT. There was a total of 4 variables compared for pre- and post-QI interventions, and all 4 variables were found to be statistically significant. Similar studies have shown associations with higher CRAFT screening result scores and substance use disorder diagnoses, and this scholarly project supports these findings, as use of the CRAFT screening tool yielded higher identifiable rates of substance use disorder diagnoses compared to the pre-QI intervention using a non-standardized screening question. Other studies have found low rates of healthcare providers' use of evidence-based substance use screening processes, often resulting in a lack of detecting substance use or any noted educational interventions regarding substance use. This project supported these findings, as pre-QI intervention showed that 0 of 154 patients had substance use screening results reviewed with them, and only 1 patient during the pre-QI intervention received interventions by the provider. The scholarly project showed that the post-QI implementation of the CRAFT significantly improved providers' documentation of completing the CRAFT screening tool and review of screening results with each patient. Additionally, the CRAFT screening tool utilization compared to the non-standardized screening question resulted in significant increase of providers performing interventions post-CRAFT screening, such as counseling, education, praise, and motivation for those adolescents already making safe, healthy decisions, or referral for treatment based on the results. These data collection supports similar studies such as Carney and Myers that found the CRAFT screening tool guided early substance use interventions such as motivational interviewing, education, and counseling that resulted in correlations with a reduction of drug and alcohol use and improvements in behavioral outcomes related to substance use. While routine substance use screening in the adolescent population is recommended, it is not widely implemented. The nursing profession and role is frequently depended on to screen and assess patients to assist in early identification and treatment interventions, including the presence of any substance use disorders. It is the duty and responsibility of nurses to assist others in enhancing their well-being and contribute to positive healthcare outcomes by utilizing evidence-based practices guidelines. This project's outcomes promote ongoing support and research on substance use screening in the adolescent population and interventions such as counseling, treatment, and referrals for care. Using the CRAFT screening tool routinely in practice can help ensure that all adolescents are being screened for substance use and substance-related risky behaviors by healthcare professionals. While this project was conducted at a behavioral health clinic, it is recommended that routine substance use screening is conducted in all areas of healthcare practice where adolescents are being seen or treated. Healthcare and organizational policy should incorporate evidence-based substance use screening, such as the CRAFT, for the adolescent population served in all healthcare organizations. Outcomes of this project set forth the need to develop a healthcare policy for improved substance use screening processes, assessment, and treatment in adolescent patients receiving care. There must be a clear development of local, regional, and national structures to support comprehensive adolescent substance use treatment services. An adolescent substance use screening and early intervention protocol that is effective could be widely applied and yield substantial benefits for public health. Using the CRAFT screening tool has implications for all levels of disease prevention, including primary, secondary, and tertiary levels. Educational interventions are recommended and guided by the CRAFT screening tool, regardless of the patient's responses. Substance use in the adolescent population is a prevalent and rising problem in our nation. If adolescents are not properly and routinely screened for substance use, their use could go undetected into adulthood, contributing to negative health outcomes, safety risk, or mortality. It is time for healthcare organizations and healthcare professionals to be proactive in the screening and treatment of adolescent substance use. The primary purpose of this quality improvement project was to evaluate the effectiveness of implementing the CRAFT screening tool compared to the use of a non-standardized substance use screening question in adolescents screened for substance use. Observed outcomes indicate that implementation of the CRAFT screening tool results in increased rates of providers performing screening, review of screening results with patients, higher rate of patients diagnosed with substance use disorders, and providers' interventions to include patient counselings or referral for treatment. These outcomes indicate that the CRAFT screening tool implementation is feasible and effective for the adolescent population. Nurses are among many healthcare professionals responsible for ascertaining that safe, effective, evidence-based care is provided to all patients, including the adolescent population. It is the duty of all nurses to advocate for the nursing profession, patients, community, and healthcare at large. This project has yielded significant results for practice, specifically those serving the adolescent population. Thank you for viewing my presentation for my DNP Quality Improvement Project. I hope that you now have a better understanding of the significance of substance use across our adolescent population and the importance of providing routine, evidence-based substance use screening and care in practice among all ages. The remaining slides include references that help support this project.